Thank you for joining me today. In this video, we are going to learn more about anxiety. Anxiety is more for teenagers. It can happen to anyone, but it's more common to youth. Anxiety disorders are common in youth, 10 to 20%. And often begins in childhood and teenager. There is a separation anxiety disorder, there is a general anxiety disorder, there is a social anxiety disorder or social phobia. So we are going to talk about all that. And the hallmark of anxiety is excessive fear or worry beyond developmental forms. And it impairs the functional like school, peer and family relationship. It affected the child to connect to others. So separation anxiety disorder is excessive fear and anxiety about separation from attachment to figures like the mother, father, caregivers. It causes anxiety. And how long that fear can last? Typically, childhood onset before age of 12 and 18, and it must last 1 month or more in children. What are the key symptoms of separation anxiety? The key symptoms of separation anxiety include distress when separating. So when the mother want to leave to work, or the father want to leave to work, or caregivers want to leave them, they have anxiety that is abnormal than other children. They worry about harm or loss of the caregiver. They refuse to go to school because they don't want to separate from their family. They think they will lose their family member or their caregiver, or something is going to happen, and that is where the anxiety comes from. They refuse to sleep alone because they don't want to lose their caregivers. They want to be attached to their caregivers. They have a nightmare about separation. They have a nightmare about separating from their family member, father, mother, who is primary caregivers mostly. It's somatic complaints. They have a headache, stomach ache because they are worry and their anxiety is higher. And the clinical key takeaway is the most common anxiety disorder in a young children leads to school refusal, can avoid into adulthood anxiety, can evolve into adult anxiety. So if the child is anxious now, it can continue even the adulthood, and it can affect how they attach to the others. Generalized anxiety disorder is other anxiety and is generalized. It is excessive, uncontrollable worries about multiple domains. They worry about the school, family, health, performance, so they have anxiety. And this generalized anxiety has to continue 6 months or more to be diagnosed as generalized anxiety. Core symptoms include restlessness or on edge. The person is always on edge. They have a fatigue. They have poor concentration because their mind goes blank. They are irritable. They have muscle tension. They have a sleep disturbance. Anxiety causes them sleep disturbance, nightmares, irritability, poor concentration, often associated with perfectionists. People who sound like or act like perfectionists, they may have generalized anxiety that they want to correct. They want to correct that anxiety. They put their anxiety to the test. That's why they're perfectionists. Somatic complaints include headache, stomach ache, highly comorbidity with depression and anxiety. So they may have depression that causing them the anxiety. There is also social anxiety disorder or social phobia. They are scared. Fear of a social situation involving scrutiny. They are worried about scrutiny. They worry about other people are judging them. Key symptoms include fear of embarrassment and humiliation. So they avoid interacting with others, avoid public speech, they avoid community gathering. Physical symptoms include blushing, trembling, so they have tremors, they sweat, so they get anxious. Takeaway is that onset often in teenagers. So social anxiety begins when the child is teenager and it continues. Leads to social withdrawal, academic impairment. All of these three anxiety disorders, they have a somatic complaints of stomach pain, headache, sleep disturbance, irritability, emotional sensitivity, avoidance behavior. They have these symptoms in common. All these anxiety disorders. Functional impairment that they have in common is they have school failure or refusal. They don't want to go to school and exposed to all that people who are judging them and who are gossiping them or they are scared of that. It's not happening, but that's what they are scared of. They have a poor peer relationship, so they don't build the connection with the people who are in their age. They have a family stressor. Comorbidity with these anxiety disorders include depression, ADHD, other anxiety disorders. So, what causes these anxiety disorders, like the separation anxiety, generalized anxiety, social anxiety? What are the causes? It has genetic predisposition. It has behavior inhibition. It has environmental stressor. It has potential moraline anxiety. It has attachment issue. So all that cause it is biopsychosocial causes. These are biopsychosocial causes of anxiety. So you want to assist them. Clinical interventions include assisting the child, the parent, the teachers. You want to use the rating scale of CBCL. You want to distinguish from normal developmental fears and depression and autism spectrum, ADHD. So you want to rule out those. You want to rule out the patient or the child don't have a depression. If they have a depression, you want to treat that so that can lower their anxiety, or that was the cause of their anxiety. You want to treat if they have autism spectrum. You want to treat that and rule out this is not anxiety, this is autism spectrum. If they have ADHD, you want to treat that and rule out and differentiate before you diagnose. Treatment. So the first line of treatment for anxiety is cognitive behavior therapy, exposure therapy, especially for social anxiety. You want to expose them. First, you want to take them from home. You want to take them close to what they are feeling. But you wanted this experience to be safe. You want to be with them and encourage them. I will be with you here. Your family is here. But we want just to go to be close to the house or work and see if anything happens that you are complaining about. So you want to expose them slowly until they realize that nothing is happening. It's just the only anxiety, but nobody's touching them, nothing is happening. And if the anxiety is moderate to severe anxiety, you want to treat depression and you want to use SSRIs. You wanted some of the medication that's good for the anxiety is fluoxetine, Zoloft. Zoloft is good for social anxiety. Fluvoxamine is also good for anxiety. So if the anxiety becomes very severe or moderate anxiety, you want to use SSRIs. Also, you want to do family therapy, school intervention, and provide psychoeducation. Prognosis. Early treatment leads to good outcome. Untreated anxiety leads to risk of chronic anxiety when they become older, depression, substance abuse, academic and social impairment. So if they have separation anxiety disorder, it is fear of a separation from family or caregiver, and they refuse to go to school or work. I don't think they are going to work, but if they go into daycare or school, they will be refusing that. And it's typically for younger children. Generalized anxiety disorder is a chronic worry across the domain and is late childhood between 12 and 18. Social anxiety is fear of scrutiny and embarrassment, and it is most common in teenagers. So separation anxiety is a separation fear. General anxiety disorder is a constant worry. Social anxiety is a fear of being judged. Thank you for joining me today. I would love to see you in my next video, and please subscribe. Thank you.